John Singleton, age 51, with Luke Perry, age 52. We're hearing more and more about young people having strokes. What would be your explanation for this?
We did lose two talented people in the last month, and it's tragic. A third of the people who have strokes are under the age of 65, and there are a variety of causes in those people. It can be a ruptured brain aneurysm, can be blockage of a brain artery, can be rupture of a tiny blood vessel inside the brain.
That's a really good breakdown of the types of strokes. If we were just to categorize them in two types, what would you say the two major types would be?
The most common type, Dr. Dorian, is a blockage of a brain artery that shuts down the blood flow and deprives the brain cells of oxygen. An ischemic stroke, that's called. That's 90% of the strokes. The other type is a hemorrhagic stroke, where either a microscopic blood vessel ruptures or an aneurysm ruptures, 10% of the strokes. That's called a hemorrhagic stroke.
What are the most common symptoms people will experience with either one of these strokes?
For the ischemic stroke or the circulatory blockage type of stroke, the most common symptoms are drooping of the face, weakness or numbness of an arm or leg, or speech abnormalities, garbled speech or nonsensical speech. And any of these signs require immediate emergent treatment, as you well know. So if somebody gets to the emergency department and diagnosed early, within the first 3 hours, they have a very good chance of a decent recovery in these circumstances. The other kind of stroke, the hemorrhagic stroke or the bleeding stroke, can often be associated with a sudden, severe, worst headache of your life type of event. And that also, the sudden, severe, excruciating, tearing, ripping headache is something that requires going to the emergency room right away. Because in either of the varieties, the bleeding in the brain or the rupture of an aneurysm, there are urgent treatments that can be life-saving.
You mentioned going to the emergency department. Does it matter what emergency department or hospital you go to?
When these symptoms occur, you should go to the nearest emergency department, unless you know that you're close to an advanced comprehensive stroke center. Those are the tertiary large hospitals that have the full range of treatment technologies available 24/7, like Geisinger Medical Center here in Danville, Pennsylvania.
Now that we've laid the groundwork of what types of strokes there are, what are the actual risk factors for you to develop a stroke?
Well, they're very similar to the same risk factors that can cause a heart attack. So they're high blood pressure, high cholesterol, diabetes, smoking. All of those can be modified either by changes in a person's lifestyle, exercise, appropriate diet makes a big difference, or by medication, treating high blood pressure with blood pressure lowering medications, antihypertensives, treating high cholesterol with statins. These can be tremendously protective and can prevent a huge number of strokes.
How about the fact that everybody says stress kills? Well, does stress cause a stroke?
You know, stress causes all sorts of physiological change in your body. It can increase stress hormones in your bloodstream that may precipitate or promote atherosclerosis, which is the underlying cause for most heart attacks and certainly most strokes. It can change your blood pressure and cause hypertension. So stroke, at least indirectly, can play a significant role in strokes as well as other sorts of vascular disease.
What makes a stroke reversible or irreversible?
There's one critical factor that's a modifiable factor, and that's time. So the earlier somebody gets to medical attention, the better our chances of dealing with a stroke and, in fact, completely reversing and curing a stroke in action. You know, Dr. Dorian, over the last several years, we've seen a revolution in the treatment of stroke. Many strokes are caused by blood clots that travel from the carotid artery or from the heart and block off a brain blood vessel. Today, we can go up with a microcatheter, snare the clot, pull it out of the brain artery, restore the circulation, and save millions of brain cells. So it's routine that we're seeing patients come in unable to speak, paralyzed on one side because of a blockage like this, and walk out of the hospital in 2 days fine. When I was a medical student, those patients, those patients were coming into the hospital, and we would start planning rehabilitation so that they could compensate for their disability. Today, they're back to normal in a couple of days in many circumstances. It doesn't work for everybody.
Well, I love this modern treatment modality that has evolved since you and I were in medical school. But what I get really excited about is knowing about what's on the future, what's on the horizon. I want to know, you being basically the lead in this complete arena, what's the technology that's to come? What can we expect in the near future that's going to be a game changer in stroke care?
I think there's two things. One of them really relates to artificial intelligence. We're now combing through the medical records of hundreds of thousands of people here in Pennsylvania. We're finding the ones with that collection of risk factors that can predict, using machine learning, artificial intelligence can predict who's going to have a stroke in the next couple of years. And we're reaching out to them and giving them aggressive blood pressure treatment, aggressive cholesterol lowering treatment, and counseling about diet and exercise. So I think preventing strokes up front is going to be one of the big breakthroughs. We can also do the same sort of thing possibly with aneurysms. There's beginning to be some evidence that some medications may reduce the inflammation in an aneurysm and prevent it from enlarging and rupturing. We're actually looking at aspirin, as simple as that. For some aneurysms, there's some beginning evidence that aspirin may reduce inflammation that leads to weakening and growth of aneurysms. So I'm very optimistic about some of these preventive strategies.
Want more extra? Hit the subscribe button and the bell and never miss a video.